Hi, I'm Gail Wetzler, and I'm the director of the curriculum in the Barral Institute for Visceral Manipulation. I am a physical therapist. I have been working in women's health for a number of years. I'm an athletic trainer, and I have been working with athletes who perhaps have dysfunction into the pelvic girdle, the low back pain, sacral, SI joint problems, and perhaps even those that travel into the lower extremities. Training in your hands, the sensitivity of your hands is getting more precise. And so did Jean-Pierre's. And as he was working with the organs in the body, he started to notice some more precision in the evaluation of the electromagnetic field and how we can feel that as a thermal zone off the body. So as he was discovering hands on the body to be able to feel attractions that could take us into our particular listening and identifying the organ involved, he also noticed that, what if my hand was further away? Years and years and years ago, as physicians worked with heat in the body to tell them if there was a pathology that was underneath that, so did Jean-Pierre discover as his hands would come up about 10 centimeters away from the body, he developed manual thermal evaluation or manual thermal diagnostics. So in this class, you get to increase the dialogue in your hands to have more sensitivity, more perception, to get specific. And where this comes in to the program is general listening, local listening. I found an area that might have restriction. Does it perhaps have the potential of a functional dysfunction or an emotional dysfunction? So he could start to determine maybe the structure had this physical tension. How do I work my way into finding the manual thermal aspect of that? Is it structural? Yes. Does it have a functional loss? Or does it also have an emotional component? So this was his start as we get into VM5 to being able to determine, is there an emotional issue in regards with this restriction that's in the body? So our theme of VM5 is it hot or not? And our hand can start determining changes in this 10 centimeter off the body to determine if there's actually an issue or a pathology that might be underneath the sensitivity of our thermal hand. And if we go and touch the body, there's a dysfunction with our listening hand, and our thermal hand picks up the sensitivity of something perhaps more important. So as you start to come into VM5, we work with the manual thermal evaluation. We introduce you to different maps that Jean-Pierre has discovered in the body that relate to certain organs. And then he started working with the potential of plexuses and the sympathetic and parasympathetic come together, and how that starts to relate to the emotions that are perhaps collected in the limbic system of our brain. So as you come into VM5, you get to look forward to the introduction to how visceral, emotional components in someone's life, their biology, their biography, how that can relate to us as manual therapists, and how we can determine how to help that person with more specificity with the potential of that issue.